The first message is we're dealing with a very common cancer. Prostate cancer accounts for probably 1,200,000 new cases worldwide every year. So it's a huge health problem. The other thing that I need to tell you is prostate cancer normally is diagnosed in most of the cases, at least in the Western world, as a localized disease. And then those patients are treated with either surgery or radiation. And a percentage of those may become what we call metastatic, so they relapse with advanced disease. The study that Dr. Parker presented applies to a group of patients that present for the first time with metastatic disease. That's not the most frequent. It's about 10% in the Western world. These numbers may change up to 60% in Asia, for instance. But still, 10% of patients, is a relevant number of gentlemen that are diagnosed every year with newly metastatic prostate cancer. The big thing of this data just presented is we were mentally used to handle these patients in a different way. And that way was cutting down the main fuel for prostate cancer, which is testosterone. And this is the way we've handled this disease for decades with what we call androgen blockade. More recently, we have added new treatments to that, as docetaxel or abiraterone acetate, but we had never considered treating the local tumor in a context of a widespread disease. And this is what the group of STAMPEDE really answered today with this study. What is the impact of treating the primary tumor, of treating the prostate, when the disease is already widespread? This is what I think is revolutionary. It's also true that does not apply the benefit to all the patients, but I think there is a substantial group of prostate cancer patients who might benefit from that. This opens a door to apply a new treatment that may have an impact in the life of these patients. There are other questions to be answered, and when the study was designed, we were not using other drugs that now have been incorporated in the setting, so we need to answer, what is the role of docetaxel or abiraterone in combination with radiation as well, but I think the data is quite provocative.